Did you guys know that one of the most powerful anti-aging ingredients has been proven over 700 clinical studies, yet most people are still using the weaker version? If you're asking retinol or tretinoin, which is best for you, then stay with me because today we're going to break down tretinoin versus retinol, what really works, and how to use it without irritation. But if you skip this, then you risk wasting years on products that are way too weak to change your skin, and you dive straight into irritation. And you quit too soon. So coming up, you'll learn three things. First, the key differences between retinol and tretinoin, along with all the others, and which one is best suited for you. Second, how to layer them with your injectables and your laser treatments for the best results. And then third, a simple ramp up plan to avoid the irritation while you're still moving the needle on anti-aging. I often hear people incorrectly describing retinoids, and so it's crucial to have a clear understanding of all the terms. Let's start with retinoids. Retinoids are the umbrella term for all of these, okay? It's a class of compounds that activate specific proteins called receptors in the nuclei of the skin cells. And these compounds can be naturally derived from vitamin A or synthetic. Then we have the term retinoic acid, or tretinoin as it's referred to, and this is the acid form of vitamin A and the active metabolite. It's the most biologically active form of vitamin A, and it's available under brands that you guys know of as Retin-A, Renova, Refisa. And funny story, I actually used Refisa 0.05% years ago when I had acne and I was trying to get ahead on my anti-aging game. And I used it just a couple times and all of a sudden I broke out in hives. It was so bad I had to go on a menstrual dose pack, but it would travel down my body. And so I shelved it for a few weeks until I got better. And then a couple months later, I'm like, maybe I'll just do once a week. I did once a week. And it's same thing happened. I broke out in hives. But of course, later on, I figured out that something in that compound or in that formulation did not agree with me. And now I can use retinoic acid just fine. But we'll get to that. Then we have tazarotene. This is an unnatural retinoid. It's a prescription strength drug used for like acne, psoriasis, and photoaging. But it's a very powerful agent. Then we have retinaldehyde, and this is one that you choose when you want more of a punch than a retinol with better tolerance than a tretinoin, especially for like the neck and the chest and mildly sensitive skin. Does that make sense? So when you've kind of graduated from the world of retinols and you're like, oh, I'm not sure if this is doing anything for me, then if you want to move slow, you move up the ladder to retinaldehyde. And retinaldehyde is typically stronger and faster working at lower percentages, and it only has to convert once in the skin. So choose a retinaldehyde between 0.05 to 1%. Then we move into the one that we've all heard about, which is retinol. This is the alcohol form of vitamin A. It's a fatty alcohol with a specific chemical structure. It has to convert twice into retinoic acid, and it has more steps to equal lower, less predictable activation, and not all retinols converts efficiently, okay? Remember that. The enzymes can be rate limited and they vary by person, age, and tissue. It's like face versus neck. And here's a closer look at some common over-the-counter or OTC retinoids and their properties. First, we have retinol palmitate. This is a really common one. This is actually an ester of retinol. It's formed by reacting retinol with palmitic acid, a fatty acid. It's a larger molecule and it doesn't quite penetrate the skin very well and has much less activity than retinol or retinoic acid for sure. Then there's the new kid on the block. This is a mouthful here. This is hydroxypinocolone retinoate. A lot of it is abbreviated as HPR. This is another ester, but it's derived from retinoic acid. So it makes it closer to the active metabolite. It's more powerful than a retinol palmitate, but definitely gentler than retinol. Then we have adapalene, and this is an unnatural retinoid. It was previously sold as a prescription, but now it's over the counter, and its main mechanism of action was for patients with acne. So some photo rejuvenation in there, but mainly acne. Now, retinoids are still the queen of topical anti-aging products, okay? Remember I talked about the skincare hierarchy in my last video? If not, I'll link it here so you guys can check it out. But it always goes, sunscreen is the king, okay? That's number one. We know this from all the data and the research. Number two is retinoids. Number 3 is alpha hydroxy acids or beta hydroxy acids. And finally, number 4 is antioxidants. But there's still a lot of confusion between over-the-counter retinol and prescription tretinoin. And it leaves a lot of people just stuck or totally misusing all of it. So the way I like to illustrate this is picture 2 batteries. One is a small AAA battery, that's retinol. And then the other is a large car battery, that's tretinoin. Both give power, but one is way stronger. And the question is, can your skin handle it, right? And many people think retinoids are optional once they're getting Botox or lasers. They're like, nah, I don't need to use any skincare anymore. Wrong. In reality, retinoids are the foundation that helps facilitate the results from those in-office treatments. So here's how they actually work. Retinol has to convert in your skin. Retinol to retinal, then to tretinoin, also referred to as retinoic acid, the active metabolite. That's a lot, I know. It's even confusing me as I'm talking about it. But stay with me. That makes retinol the weaker and the slower version. But the benefits are it's definitely more gentler on your skin. Tretinoin arrives already active, so it needs no conversion, so you get much stronger results and a higher risk also of irritation. All right, so what's the evidence? Well, tretinoin is definitely still the gold standard, and 12-month biopsy studies show increased collagen, reduced fine lines, reversal of photoaging changes, and then retinol has validated improvements too, but it usually needs concentrations of 0.3 to 1% to see real change. So who should use what, right? Well, retinol is really great for beginners, okay, or sensitive skin, those of you in your 20s to your 30s. And it's also really good for in-office treatments. If you want to really stay consistent with a retinoid, but you have to dial down from tret because you're getting injectables or lasers, then retinol is great. Retinol also helps to increase cellular turnover, which is really great for when you're trying to slough off some of those mends from lasers or those little sandpaper scabs. That can help as well. Tretinoin is really the best for advanced aging, right? So if you're 40 and above, I would just recommend, if you're going to go on the weaker version, just do that temporarily and then ramp up. It's also great for pigment-prone individuals, anyone with melasma or other, sun damage on their skin, acne scars, wrinkled or crepey skin, or anyone that's just ready for more of a visible change. So how do you use a retinol with procedures? Well, before a laser, you're going to stop everything about 3 to 5 days prior. But then after a laser, you're going to pause, obviously, until your skin is fully restored and healed. And then you're going to gently kind of start back in with a retinol. Or, if you can alternate days with a tretinoin. For injectables, you don't really need to stop beforehand, but avoid applying the retinoid the same night as the injections. So now we're going to break it down a little bit. We're going to give you your tretinoin ramp up plan. So on week 1 and 2, you're going to use your tretinoin 2 nights per week. That's it. So choose like a Tuesday and a Friday. And then on weeks 3 to 4, you're going to start to use it every other night. Okay. After you get through that, on weeks 5 and above, you're going to use it every single night if it's tolerating, right? If you can tolerate it. For sensitive areas like around the mouth or around the eyes, you can do that moisturizer sandwich where you put the retinoid on and then you put a moisturizer on top of that. Or if you just want to avoid sensitive skinned areas like your eyes and maybe around your mouth, that's fine too. So now let's do some troubleshooting. So if you're too dry or irritated even using that twice a week, then just switch to retinaldehyde and buffer with a moisturizer. I personally have found the unicorn tretinoin, which is ingredients vitamin E, vitamin A, and this has completely solved my problem with commercial tret and, the Refisas and the Renovas. And now I finally have a formulation that keeps my skin hydrated, but delivers the active in a much smoother way. So I know, shameless plug, but again, I have searched high and low for the appropriate retinoic acid. And because of the tocopherol, the vitamin E, and there's a little bit of shea butter in there as well, it really does help leave the skin nice and hydrated. So game changer in my world. Now, if you hit a plateau with any retinoid And you'll know it because you'll use it every single morning and the skin doesn't react at all, and you might not see really any visible changes. Then you want to increase your strength, okay, or step it up to the tretinoin. Now let's talk about some common mistakes to avoid. The first one is expecting overnight results, right? I'm sure a lot of you don't expect overnight results, but especially if you're using a retinol, it's going to take weeks and weeks to see any progress. If you're using a tret or retinoic acid, within about 2 to 3 weeks, you're going to start to see that your skin has a beautiful glow, your skin is smoother and softer. And also, side note, something that can come with using retinoids is milia, little tiny white little bumps that are on the skin. And they look like pimples or whiteheads, but they're not. And when you go to pop it, nothing comes out. That's milia. Your provider needs to kind of poke it with a little lancet and pop it out of there. And it's like a little tiny little cyst or ball. So they usually don't come back, but that's something, side note, you should know about. The other mistake that I oftentimes hear is skipping sunscreen. We all know this by now. We should. Some of us don't use sunscreen when they're using a retinoid. And that's a really big mistake because UV breaks down collagen and triggers pigment and inflammation, which undoes the retinoid progress, right? And it makes you even more susceptible to all that. So the other common mistake is using harsh scrubs at the same time too. This compounds the irritation, right? An exfoliator or a scrub should only be used once a week when you're on a retinoid, and you need to be gentle. So now you know when to choose retinol or tretinoin and how to use them with your in-office treatments, but you still should know that retinoids are only working if the rest of the routine can support them. So if you're still wondering, what about all the other skincare products I'm using, or how should I use them all together, then here's your next step. Watch this video on how to build the best skincare routine after 40. You'll get the 4-step AM and PM capsule routine, or check this video out on what is the difference between over-the-counter products and medical grade skincare.